see it?
I can come close.
Want your chair, Leslie?
No,
Anytime, sir.
Okay. We're going to talk about bumpers. A bumper is an amazing little appliance because I'm going to change this, I'm sorry.
No problem. We'll start all over again. And do me a favor, sir, when you pull your hands back a little bit before you start.
Back here?
Yep,
Okay.
anytime.
We're going to talk about the bumper. The bumper is an amazing little appliance because it can distalize teeth without exerting any force against any other teeth in the mouth. It's the lip pressure that pushes against the bumper that pushes the molars back, and they go back about 1 millimeter per side per month. So if you have like a 4 millimeter degree of crowding, you can pick that up in 2, maybe 3 months. The first month you don't get much change, but the second and third, fourth, and so on, you get 1 millimeter per side per month. So the bumper is most frequently used in the lower arch, but it can be also used in the upper arch. So normally, we can estimate the size of a bumper from copies of models that you send us, but in your own office, if you were to estimate for the size, you estimate approximately where the tube on the first molar will be, which would be about mid-center of the mesiobuccal cusp on both sides. And so if we take a bumper, and they come in 8 various sizes, if we put the smallest size on there, you can see that these little insets in the back are nowhere near those teeth. This would fit the deciduous second molars very nicely, but not the first permanent molars. If we take the next size, that also is way too small because these inserts here, these offset bends, belong way back here instead of halfway forward. So then we take the next size. And if you notice, this size fits almost perfectly, and it's about 2 millimeters spread apart from the teeth all the way around. So this would be the correct size bumper for this particular dentition. And we would do the same on the upper arch. If we use this appliance for the upper arch, you see that that is the correct size for that arch. When we put the bumper on, we keep the lower part of the bumper level with the gingival tissue of either the upper or the lower teeth. So when a bumper is in the mouth, for example here, you see that the lower part of the bumper, this one is even maybe a little bit too low, but it should be about level with the gingival margin. If we put the lower bumper on here, and the bands have a 045 tube gingivally, you can see that bumper is approximately level with the lower gingival margin of those lower teeth. Now when the lip pushes against that, it will push against these teeth, and they go back about 1 millimeter. So then the bumper gets closer to the tissue. So the first month you have to take and advance that bumper 1 millimeter every month. So you always want to leave extra material sticking out of the back of the bumper on both sides. So we take and we use what we call a Bergersen lock. This is a little lock with a hex nut on it, and there's a little wrench, and that can be slid back and forth on there. For example, if you wanted to advance the bumper 1 millimeter, you would put this little lock against the offset bend, and that would advance the bumper 1 millimeter. You would put one on both sides. The next month, you don't even have to take the bumper out. You just pull it forward and slide this back about 1 millimeter and tighten it up again. And then it would move the molars back another millimeter. And you'll see space opening up between the two deciduous molars. You don't see space back here, but you see space opening up here. And then if you wear an appliance, for example, one of our appliances that will straighten the front teeth, it'll start straightening these front teeth as this space is opened up, either on the upper or the lower. So if you have a case that has significant crowding, and these are mostly in adult cases, but once in a while in a mixed dentition case, you have extreme crowding, which is not present here, but it avoids the necessity of stripping enamel off of teeth. This is a way of preserving the enamel, and also you preserve the occlusion because the teeth will be intercuspated perfectly. If you strip teeth, then they won't be in their normal positions. You'll have a malocclusion in back. So anyway, we take a band and we fit it, and we can size the band for your case. We're going to cement this one on here. So we try it on, and we use a band pusher to push the band down around the tooth, and we see if it fits nicely. And then we push the edges against the tooth. Sometimes if the band isn't fitting quite nicely, you can take what we call a 139 plier, and you can push in the gingival margins to make it hold better. But usually if you get the right size, it'll work very well. Now we're going to cement this band on, and we use any kind of dental cement. This is glass ionomer cement that we're going to use here. And so we're going to cement this band on this tooth. We'll use a rubber glove on our one hand that we're going to, you'd use it on both hands, of course, for a patient, but we'll just put this on my one hand, and we're going to mix the cement first. And we have maybe about a minute or two to work with this, 30 seconds of mixing. And it's an awfully small pad, but I would suggest you use a large glass pad that you can refrigerate, and it'll allow you more setting time. So we're going to simply mix this cement up. Now it's pretty good working shape. Now we're going to fill the band up, but before we do that, we put a little wax on the openings so we don't get the little tube openings full of cement, which is a problem. So now we're going to fill the band with cement. And we're going to push that down. I'm going to take my glove off so I don't get my sticky fingers over everything. Then we push that band down. Okay. Now there are band seaters that you can use. It's similar to this that you can have the child bite down on, but we put a cotton roll so it doesn't chip the upper teeth. And then when that cement is hardened, we'll clean it off, take the cement off. Is there a towel, Leslie, I could have? That's great. I'll just take one. You want to make sure that tooth is dry. You might pumice it first a little bit to make sure any grease or food particles and so forth are off of there. Now we're ready to put the bumper on. And we will put that, which is my bumper, I think this is the one. And we'll fit that in there and when the band is completely dry. When we fit the bumper, we want to make sure that the back ends are parallel with each other. And we put the bumper into one band in the 045 tube, and we see that the other is parallel to that tube. If it isn't, we bend it in with a plier. And when we finally put the bumper in, we'll take and enlarge it just a little bit so it widens the molars. So as they're distalized, they will widen as the mandible gets larger in the back. Also, when you widen the bumper, it creates interferences with the upper dentition and it drives the bite open, maybe a millimeter or two. So it's a very effective little appliance. When we put it on, then we would not put the Gurren lock on there immediately. We might put that on there the second appliance, visit. And then we tie this in. And there is a little hook, if you notice here. And we use a chain elastic from the back up to the front. And we put the chain elastic usually around the tube first. We put the bumper in, and then we pull it forward and hook it on one side. Now, if they're right-handed, we usually hook the left side. So they can pull the right side out and brush around their teeth, and then they can move it back. So we don't want to put it in without tying it in, because if that happens, the patient will take it out, and then they'll lose the bumper, and it's very hard to then get another one to fit. We do not recommend that you open or close this loop. This is called an omega loop. And if you open that, it changes the direction of the back, and it's very hard to get it into the tube again. These have been digitized from bumpers that we use for many years, and so they fit usually with 2 or 3 tries. They're a very easily used bumper. So now we're going to put this in the tube back here, and we're going to put the other in the other tube. And when you put it on, you want to move it back and forth, that it moves rather easily, so you don't end up forcing teeth too much to be torqued. But that bumper fits pretty well. We want to leave about 3 millimeters of bumper wire back here so that when you advance it, you don't run out of wire. But you don't want that to dig in to the soft tissue of the mandible. Now, the upper can be done in the same way. Now, we have soldered little extension wires here to open it up here. This is really not necessary because we can take and we can strip the second deciduous molar on the mesial, and when you put the appliance in, it'll move all the teeth distally to the space that's being opened up in here. So, you know, from stripping, we can pick up about 4 millimeters, but when you need more than that, a bumper is a tremendously handy device to use. We can digitize from your model. We can digitize the size of the band that you will need. We can supply you with the band, the bumper, the Gurren lock. We can supply you with everything that you need to put the bumper on. And after about, maybe 2 or 3 or 4 bumper uses, you'll get used to it. So it's really a very easy technique to use. And then you want to keep them low, but you don't want to have a patient miss an appointment, because if they do, this bumper may scratch into the canine eminence and denude tissue. So you want to make sure you see the patient every month in order to advance that bumper, because every month those molars will move distally. Now, if you are at a certain point when the second molar is caught in the embrasure between the enamel and the cementum, you want to wait until that second molar is halfway up the crown of the first molar before you start distalizing it. If it's down below and there's about 1 millimeter or 2 distance between the first molar and the erupting second molar, it's okay, you can distalize, but you don't want to impact your second molars. So that's the only problem that I can see. Once in a while, we might use a bumper on the second deciduous molars, very rarely, but you can do that and distalize even early in the primary dentition. Anyway, that's the story of the bumper. They're a wonderful device. By the way, the plastic is all FDA approved. You can heat this in a blue flame and actually shape it with your fingers if it doesn't match the soft tissues. Sometimes the hooks may be out a little bit or in, and you can heat that a little bit with a sharp blue flame and then bend them even with your bare hands, and they work very well. As the bumper moves the teeth back and you've got enough room, Then you can start trimming the shield in front with an acrylic burr and get it down so that it's almost only wire showing. Then the teeth won't distalize anymore, but only they'll be held in position. But at that point, you can take the bumper out, and by that time, your case should be straightened out with one of our appliances. Do you think that's okay?